When I was a medical student, many of the patients that we view as almost commonplace today never survived.
Hi there. How you doing? How are you? You all right? You doing okay?
We're able to now succeed with things that formerly we weren't able to.
How early did you get up?
We are able to do very highly expensive therapy for patients with serious problems. But children are disadvantaged if they develop heart failure.
The ICUs are very full. So, busy day.
We like to say that if a child comes here with any problem related to the cardiovascular system, that we have a therapy that is state-of-the-art to offer them. Not that they come here and we look at and say, well, we can't take care of that here, we're going to have to send you somewhere else.
So we'll see this family, this child, and then by the time I'm finished with that, they should be about ready for surgery.
I don't think there is any job in the world more stressful than dealing with babies that are either newborns or in their first days of life with a heart defect. They are very critical patients at the complete mercy of those who are caring for them. Not just the baby, but the family.
The right side of the heart is a little bit enlarged because it's handling more blood than normal. So it will require open heart surgery, but we could put this off for a year or two if y'all were of a mind.
Your options nationally, if you have a child with congenital heart disease that needs surgical repair, are frighteningly vast. And you can get any quality of medical care that you can imagine, from the worst to the absolute best. Why people always don't demand the absolute best for their child is usually because they don't know any better and they're scared. The more heart surgeries they do, the better they're going to be. You do not want to go to a place that only does a couple a year.
Today is a very busy day. He's in meetings this morning, and he'll probably pop through the auditorium and see the ambassadors on call, the potential donors to the hospital, and then he'll swing through here. We'll do a few things, and then he'll probably go back to the operating room. He's also got a consult to work in this morning. And then he has meetings until 6 o'clock tonight, so probably between 6 and 7, he and I will get to sit down and go over the day.
So Dr. Fraser is right now talking to a family and assessing a patient that he might have to take back for surgery. I think the plan is to take them back, but he's got to really decide. He's going over the chart, looking at all our details, and so he's got part of his team there, and they're all kind of deciding. It's like a team huddle to come up with a game plan for the day.
We'll just hold until we're sure that we have one. If we don't, we can't do it.
I'll work on that.
Yeah, it's a pretty difficult problem this girl has. We knew it was a difficult problem going in, and it's going to involve a series of operations, so I'm sure they're a bit disappointed that we're having to do another operation right now, but it's kind of within the sort of the realm of expectation. So.
How old is the girl?
She's 4.
4.
Mm-hmm.
When he examined her, he was a little bit concerned about some events that had happened overnight.
This is going to take a lot of fiddling.
Okay. In the meantime, I've also talked with the family that was scheduled for today, let them know that there's a chance that they may not have their surgery due to this emergency in the ICU, but it's dependent upon instrument availability. We're all on hold. Everything's on hold for the OR with Dr. Fraser.
The public in general thinks big building, big medical center, everything's great. And that is a big mistake. These units, which are very rare, are highly complicated, very delicate, symbiotic propositions.
Rolston is 5 months old, and he's 2 days out from a bilateral reunion.
It's not for people that want a side job doing it while they're doing something else. It's a very specialized field that only specialized, trained, dedicated teams should be even thinking about doing.
What a job to operate on babies' hearts every day of your life. I'm convinced that congenital heart surgery is the most difficult specialty in medicine. First, dexterity of hands, the actual physical ability to do this work. You've got to stitch extraordinarily fine, small vessels together. One of the PAs described it to me. He said it's like trying to stitch together wet tissue. That's how delicate it is. And sometimes that tissue is disintegrating because the body is producing a prostaglandin that is making certain structures disintegrate. I mean, it can be like the texture of tofu. Your stitches have to be uniformly placed. If they aren't uniformly placed, there'll be uneven stresses where that tissue comes together and won't heal properly and can even burst. Often you don't know what you're going to encounter until you get in there and you see it. And then you see it and you've only got a half hour to fix it if the child is on bypass, for instance. The need for speed, precision, and intellectual smarts is higher than in any other specialty.
The operation is going to involve transecting all this, repairing the aortic arch. So it's like you're looking down, the heart's underneath the page. This is the patient's back, patient's front. The surgeon would have to rotate it through whatever that degree of arc is.
Often you're working on a heart that doesn't have any blood in it, and it's flat. And you have to imagine, as you're sewing this valuable tissue into this vessel that you've reconstructed, you've got to imagine what it's going to look like when it's inflated with blood. You've got to have a great three-dimensional imagination.
So I had a few things I was going to talk to you about. Maybe we can get together later on.
I think this type of work attracts a certain type of individual. I don't mean to sound self-serving, but I think people have to be incredibly committed to do this. You know, the days are extremely difficult. The emotions are always on edge, but we have a group now that's mature and that they've been at this for a long time. It is an extraordinary team. Even despite that, you know, biologic systems and people are very fragile, and sometimes we can't overcome that.
I heard that there's a patient we're going to have to take off ECMO support probably a little bit later today.
She was on ECMO, the blood being tunneled through a machine and it gets oxygenated. She had a very huge abdomen and they needed to open her up just to see what was going on. And when they opened her up, they found that her bowel was very necrotic, and that's not something that can be fixed, unfortunately. So the plan is to take her off and let her die on her own. It doesn't happen a lot, but when it does happen, it's very hard for everyone. And so, of course, my mind went to the fact that the mother won't see that baby anymore after 1 o'clock today. That interaction will be over forever, and all she'll have is the memories. And it becomes so profound because you know that it's the end of something, of a beautiful life that really didn't have enough time.
These are extremely complicated patients we deal with. And the good message is that 98+% of the time in this institution, even these complicated kids are going to do great. So it's very hard when one doesn't. You know, there are many kids with complicated heart disease that 15 years ago would have had a 50-50 chance of making it through. We now expect 90% of those kids to make it through. So I think those are the successes that you get when you have the resources in an institution like this.
Congenital heart disease is the most common birth defect by a long shot. It's estimated that about 1% of the general population has a significant congenital heart problem.
You hear about all the congenital heart problems with little children and what Texas Children has done and how they're ranked. So for us to actually be in the operating room was a great treat, and you got to see Texas Children's at its best and one of the best surgeons.
We saw Dr. Fraser operating on a 4-year-old little girl. It's educational opportunity as well as getting to know the hospital a little bit better. You guys have the superstars here, and people just don't know it.
The surgery is designed to return the heart to normal work. So we take a piece of the sac that the heart sits in, that's called pericardium. It's very strong in its zone, so it's resistant to infection, encourages healing.
Many of our children are going to need 2 to 3 to 4 operations. And so not only do you have to think about the operation you're doing now, but you need to be thinking of the operation that's going to happen in 2 years. Also, it's a danger to the patient because when you re-enter the sternum, if the heart is stuck up to the sternum, you can injure the heart.
It's very difficult and harrowing to reopen a chest because it's got all this scar tissue there and it's all connected and it's all those vessels are sort of wrapped in scar tissue. It's very hard to get the heart free enough to reoperate.
And it's very noticeable when you are operating on a child who's been operated on by someone else. We get many children from outside institutions who then transfer their care here. When we operate on that child, I definitely notice a difference.
Bad craftsmanship doesn't heal very well. And when it doesn't heal very well on this very important organ, you're going to need to go back and fix it.
Dr. Fraser and everyone here have similar operating techniques, and so that if I would happen to operate on someone else that Dr. Fraser, because he wasn't in town or something, had operated on, it's not that different.
I had congenital pulmonary stenosis. I was followed from the time I was an infant, and it turns out that eventually I need to have a valve replacement, so that's why I'm here today.
Bruce had surgery as a 13-year-old here by Dr. Cooley and is coming back at the age of 51 to have additional heart surgery. And what we've learned by following these people over decades is that they do have residual problems. And so we finally found a way to grow these people up into adults, and now it's a whole new subspecialty that the Heart Center is embracing, and we have a team of cardiologists that are dually trained in adults and pediatrics that are now equipped to take care of these kids.
Right now, there's only one case scheduled both those days in the other rooms. So if I can roll rooms, I can do this either day.
Okay.
In pediatric subspecialty, particularly pediatric subspecialty surgery, there are very, very few individuals in the pond. We have got to have the best and the brightest, and that costs money. So we have to really focus and make our recruitment packages attractive.
It's very important to me that we develop together what is really the definitive heart center. We have to take things to new levels. And I know with Dr. Fraser, really do great things.
I love his overall passion, not just for his respective specialty, but also for his care about everything that we're doing here at TCH. He wants to see the entire surgery department at Texas Children's Hospital made better, not just congenital surgery, but every other single section of surgery at TCH be lifted and to grow and to soar to higher heights.
He feels at home in the operating room like no other place. He also has other talents too. He's a great leader, and I think he's definitely the right man for the job. As far as the surgeon-in-chief position, he's got very ambitious goals for the department here, but it does take away from his time in the Heart Center, and I think he struggles with that. He probably works too hard trying to do both jobs.
Please do not place drinks on shelf. That was definitely aimed at me. I mean, I'm happy with my other job as being a cardiac surgeon, but I am trained as an academic surgeon. I've maintained my board certification in general surgery for a reason, and that is I was educated in it, I enjoy it, and it has bearing on my day-to-day life as a cardiac surgeon. So I think about the patients more than just their heart. When children get appendicitis, they get heart failure, they get dental problems, they're born with complex craniofacial problems, they have neurosurgery issues, they get broken bones. Children need surgery, and they need surgery in a children's hospital from the best specialists that can offer it. And that's what Texas Children's is about.
This place has such potential, such great potential, but for people to go down and find the diamond in the rough and clean it and make it shine, time is needed. Resources are needed. Without time and resources, the diamond will stay in the rough. It won't be shining. Until people realize it and accept that there has to be a commitment to it. We will commit time, we will commit resources for it, and we'll find the support that is required to make that happen. It's not going to happen.
He has a vision to make this not only a clinical powerhouse, but an academic powerhouse. What really separates people is their effort and their work ethic. And that's what I think separates us as a team. Is our desire to go the extra step, to do the patients that no one else wants to do, and to spend all that time, not just the surgeon, but the anesthesiologists and the nurses and everyone else that gets involved. This kind of career, it's not a sprint. It's a slow progression. That I've really appreciated. Now that I'm looking back over those years as a mentor, that is one of the main things that I've come to understand that he did for me.
It's nice to work for somebody that is so well recognized and respected in his field. I've worked for other heart surgeons in the past, and he's a heart surgeon with a conscience, and he really, truly cares about his patients.
There are lots of surgeons around the world who throw things around and, act like, I suppose, a bit like opera singers. But it's a very rare person who is gentle but not weak. That sort of inner strength and humility, I think, is very engaging.
I think he's more than just a physician. I think he's a healer, because he brings every resource available to him to bring about care and cure in children. Even though I'm close to him, I want people to know the high regard and respect that I have for Dr. Chuck Fraser, because I want them to have it too.
You know, if someone asked me what was a consistent feature of excellent congenital heart surgeons, it's tenacity. If the operation took 4 hours, it took 4 hours. If it took 10 hours, it took 10 hours. However long it took to get it right, and if it wasn't quite right, to have the courage to say it's not right and go back and do it again.
There is no when surgery is done or when the cath lab is done, because you don't know when surgery is done. And if something is not done right, you just redo it again. You just keep going at it. This capacity to have to live like that, to perfect what you're doing and put into it everything you have and all what you are, finish your day and still come back again tomorrow and do it again. That's the kind of people that form that team.
When he has to go back to the hospital or not come home, I think about the mother. Everything else pales in comparison to that. That's somebody's baby. And so I have good understanding for that, having 4 babies. I can't imagine being married to any other person or any other field. And it's got to be the most rewarding work on earth.
You know, when someone entrusts their child to you, it is a daunting responsibility. And I think that is what drives us all to really to give those children the absolute best quality that we can.
You know, God bless the people who do this work. But I just couldn't take it.
I'll see you guys tomorrow.
See you tomorrow.
All right. Good night. Thank you very much.
I am so grateful for those people who choose to do it with their lives.